NCLEX-RN 800 Questions and Answers Newest Practice Guide. Question 1. What is the rationale for using a TENS unit? Option A, ultrasonic effect. Option B, endogenous opioids. Option C, gait control theory. Option D, prevention of muscle spasm. The correct answer is option C, gait control theory. TENS units work by stimulating large nerve fibers to block the transmission of pain signals in the spine. Question 2. What is the basis for phantom limb pain? Option A, psychological. Option B, nerves carry sensation to brain. Option C, cause is unknown. Option D, spasms and edema. The correct answer is option B, nerves carry sensation to brain. Phantom limb pain is thought to be caused by nerve endings misfiring signals to the brain. Question 3. What should be at the bedside after a thyroidectomy? Option A, a dressing supplies. Option B, narcotics. Option C, tracheostomy set. Option D, communication cards. The correct answer is option C, tracheostomy set. Tracheostomy equipment is essential to manage immediate airway obstruction from glottal edema. Question 4. What assessment finding should be prioritized in hypoparathyroidism? Option A, tetany. Option B, hypocalcemia. Option C, depression. Option D, cataracts. The correct answer is option A, tetany. Tetany is the most common and immediate clinical sign of hypocalcemia resulting from parathyroid dysfunction. Question 5. Which of the following demonstrates denial in a diabetic client? Option A, eating high sugar foods. Option B, refusal of insulin. Option C, casual attitude toward illness. Option D, complaining about diet. The correct answer is option C, casual attitude toward illness. A casual approach to a lifelong illness that has been present for 30 years indicates long-standing denial. Question 6. What must a gastrectomy client understand to prevent anemia? Option A, monthly blood transfusions. Option B, increased iron intake. Option C, small frequent meals. Option D, a vitamin B12 therapy. The correct answer is option D, vitamin B12 therapy. Total gastrectomy removes the site of intrinsic factor production, making lifelong vitamin B12 replacement necessary. Question 7. Which condition is associated with Shane-Stokes respiratory patterns? Option A, diabetic ketoacidosis. Option B, fever. Option C, increased intracranial pressure. Option D, spinal meningitis. The correct answer is option C, increased intracranial pressure. Shane-Stokes breathing is a rhythmic change in the depth of respirations often associated with increased intracranial pressure. Question 8. Low levels of which electrolyte are associated with insulin resistance and type 2 diabetes? Option A, potassium. Option B, magnesium. Option C, sodium. Option D, bicarbonate. The correct answer is option B, magnesium. Low magnesium levels can increase resistance to insulin and lead to carbohydrate intolerance in diabetic clients. Question 9. What is the most likely cause of diminished breath sounds on the left side after endotracheal intubation? Option A, left-sided hemothorax. Option B, right-sided hemothorax. Option C, right mainstem bronchus intubation. Option D, inadequate mechanical ventilator. The correct answer is option C, right mainstem bronchus intubation. The right mainstem bronchus is at a smaller angle, making it prone to accidental intubation, resulting in absent sounds on the left. Question 10. Which blood gas parameter primarily reflects respiratory function? Option A, partial pressure of carbon dioxide. Option B, carbon dioxide content of the blood. Option C, bicarbonate. Option D, base excess. The correct answer is option A, partial pressure of carbon dioxide. The lungs regulate the partial pressure of carbon dioxide, making it the primary marker for respiratory function. Question 11. What is the maximum cuff pressure for an endotracheal tube to prevent tracheal erosion? Option A 10 mm mercury. Option B 20 mm mercury. Option C 45 mm mercury. Option D 60 mm mercury. The correct answer is option B, 20 mm mercury. Cuff pressures should not exceed 20 mm mercury to prevent tracheal ischemia and erosion. Question 12. Which fluid is compatible for intravenous administration with phenytoin? Option A ringer lactate. Option B dextrose 5% in water. Option C dextrose 5% in ringer lactate. Option D normal saline. The correct answer is option D, normal saline. Phenytoin will precipitate in all solutions except normal saline. Question 13. What is the highest priority nursing diagnosis for a client with burns to the face and neck in the first 8 hours? Option A fluid volume deficit. Option B alteration in comfort. Option C alteration in sensation. Option D alteration in airway integrity. The correct answer is option D, alteration in airway integrity. Airway integrity is the priority due to rapid edema formation in the neck and face following thermal injury. Question 14. In a 3-bottle chest drainage system, what is the purpose of the water seal? Option A a collection of drainage. Option B pressure regulation. Option C prevent accumulation of blood. Option D prevent air from entering chest. The correct answer is option D, prevent air from entering chest. The water seal allows air to exit the pleural space during expiration but prevents it from re-entering during inspiration. Question 15. Which laboratory value should be monitored during gentamicin therapy? Option A, creatinine. Option B, sodium. Option C, calcium. Option D, potassium. The correct answer is option A, creatinine. Gentamicin is nephrotoxic, requiring close monitoring of serum creatinine levels to assess kidney function. Question 16. What is the appropriate action if redness and warmth are found at a central line insertion site during dressing change? Option A, discontinue the line. Option B, begin a peripheral line. Option C, document and notify the physician. Option D, clean and redress the site. The correct answer is option C, document and notify the physician. The physician must be notified to evaluate the site and determine if a new central line is required. Question 17. If suction sputum is blue in a client with an enteral feeding tube, what does this indicate? Option A, the client aspirated tube feeding. Option B, the catheter is in the esophagus. Option C, this is a normal finding. Option D, the feeding is infusing into the trachea. The correct answer is option A, the client aspirated tube feeding. Blue-tinged sputum after feeding tube placement indicates aspiration of the formula into the airway. Question 18. Which medication is the drug of choice for pain in a client with pancreatitis? Option A, morphine sulfate. Option B, ketorolac tromethamine. Option C, promethazine. Option D, hemiparidine. The correct answer is option D, meparidine. Meparidine is preferred because it does not cause spasms of the sphincter of Oddi like other narcotics. Question 19. What is the first nursing action when unable to palpate dorsalis pedis pulses? Option A, palpate again in 15 minutes. Option B, use a Doppler to assess. Option C, document the finding. Option D, call the physician. The correct answer is option B, use a Doppler to assess. A Doppler should be used to confirm presence or absence of pulses when they cannot be palpated. Question 20. What response is expected with the administration of metoclopramide? Option A, increase in gastric secretions. Option B, increase in peristalsis. Option C, disorientation. Option D, drowsiness. The correct answer is option B, increase in peristalsis. Metoclopramide increases peristalsis and accelerates gastric emptying. Question 21. What is the correct order of kin to ask for informed consent for an unconscious adult? Option A, parent, spouse, adult, child, sibling. Option B, spouse, adult, child, parent, sibling. Option C, spouse, parent, sibling, adult, child. Option D, parent, spouse, sibling, adult, child. The correct answer is option B, spouse, adult, child, parent, sibling. The standard legal order of next of kin for medical consent is spouse, then adult, child, then parent, then sibling. Question 22. How should a small amount of bloody drainage on a surgical dressing be documented? Option A, serosanguinous. Option B, purulent. Option C, sanguinous. Option D, catarrhal. The correct answer is option C, sanguinous. Fresh bright red drainage is classified as sanguinous drainage. Question 23. What is the complication where abdominal viscera protrude through a surgical incision? Option A, excoriation. Option B, dehiscence. Option C, decortication. Option D, evisceration. The correct answer is option D, evisceration. Evisceration is the protrusion of abdominal organs through a separated surgical wound. Question 24. What does red granulated tissue in a surgical incision indicate? Option A, infection. Option B, not healing. Option C, necrotic tissue. Option D, healing. The correct answer is option D, healing. Red granulated tissue and the presence of fragile capillaries are positive signs of a wound healing by granulation. Question 25. A client post-femoral popliteal bypass graft has a cool dusky foot with no palpable pulse. What is the priority action? Option A, continue to monitor. Option B, notify the physician immediately. Option C, reposition the client. Option D, assure the client. The correct answer is option B, notify the physician immediately. This is a vascular emergency indicating a graft occlusion which threatens the limb. Question 26. Why might a surgeon choose not to use the internal mammary artery for a bypass graft? Option A, takes more time to remove. Option B, higher risk of reocclusion. Option C, smaller in diameter. Option D, has too many valves. The correct answer is option A, takes more time to remove. The internal mammary artery takes significantly longer to harvest compared to the saphenous vein. Question 27. What is the most important electrolyte to monitor following a coronary artery bypass graft? Option A, chloride. Option B, bicarbonate. Option C, potassium. Option D, sodium. The correct answer is option C, potassium. Potassium must be monitored closely to prevent supraventricular tachyarrhythmias following cardiac surgery. Question 28. Which instruction demonstrates understanding of colostomy care? Option A, tape a leaking pouch. Option B, cut the skin barrier 1.5 inches larger than stoma. Option C, change the pouch only when leakage occurs. Option D, use a skin sealant under pouch adhesives. The correct answer is option D, use a skin sealant under pouch adhesives. Skin sealant protects the epidermis during the application and removal of the pouch adhesive. Question 29. What statement indicates understanding of care for an ascending colostomy? Option A, I should not irrigate my colostomy. Option B, my stool will be soft like paste. Option C, my stoma should be red and slightly raised. Option D, the skin around my stoma may be irritated by enzymes. The correct answer is option C, my stoma should be red and slightly raised. A healthy stoma should appear red and slightly raised. Question 30. How should the nurse respond to a client complaining of phantom limb pain after an amputation? Option A, remind him it is in his mind. Option B, explain the pain is real and should be treated. Option C, the cause is unknown so just support him. Option D, treat with non-narcotic medication only. The correct answer is option B, explain the pain is real and should be treated. Phantom limb pain is a real and intense physiological sensation requiring appropriate pain management. Question 31. What is a major complication after a thyroidectomy? Option A, respiratory obstruction. Option B, hypercalcemia. Option C, fistula formation. Option D, myxedema. The correct answer is option A. Respiratory obstruction. Respiratory obstruction from edema or tracheal compression is a life-threatening complication following a thyroidectomy. Question 32. What information should be given to a client about hematuria following a prostatectomy? Option A. It should not be there on the second day. Option B. It will stop when the catheter is removed. Option C. It is normal and not a cause for concern. Option D. It can be removed by irrigating the bladder. The correct answer is option C. It is normal and not a cause for concern. Small amounts of hematuria are expected for several days following prostate surgery. Question 33. A client is concerned about urinary incontinence after Foley catheter removal post-prostatectomy. What should the nurse explain? Option A. It will resolve quickly. Option B. This is usually temporary. Option C. I will keep you dry. Option D. It is related to bladder spasms. The correct answer is option B. This is usually temporary. Postoperative incontinence is common but generally resolves over time as sphincter control returns. Question 34. What is a priority nursing diagnosis for a client post-cholecystectomy? Option A. Knowledge deficit. Option B. Urinary retention. Option C. Impaired physical mobility. Option D. Ineffective breathing pattern. The correct answer is option D. Ineffective breathing pattern. Postoperative clients are at risk for pneumonia because the incision location causes shallow breathing and poor aeration. Question 35. What is a nursing intervention following a left pneumonectomy? Option A. Monitor chest tubes. Option B. Position on the right side. Option C. Position in semi-Fowler with pillow under shoulder. Option D. Monitor the right lung for RALs. The correct answer is option D. Monitor the right lung for RALs. After a pneumonectomy, fluid in the remaining lung can cause distress, making monitoring for adventitious sounds critical. Question 36. What is the first nursing action for a postoperative pneumonectomy client with fresh blood on the dressing? Option A. Reinforce the dressing. Option B. Continue to monitor. Option C. Notify the physician. Option D. Note the time and amount. The correct answer is option C. Notify the physician. Any fresh bleeding on a surgical dressing requires immediate physician notification to assess for surgical hemorrhage. Question 37. What type of rejection occurs 3 months post-kidney transplant with tenderness and malaise? Option A. Acute. Option B. Chronic. Option C. Hyperacute. Option D. Hyperchronic. The correct answer is option A. Acute. Acute rejection commonly occurs weeks to months following transplantation and presents with organ tenderness and flu-like symptoms. Question 38. What does the client with a vertical partial laryngectomy need to know? Option A. I will need swallowing training. Option B. My voice will be excellent. Option C. I will have very little difficulty swallowing. Option D. I may have a radical neck dissection. The correct answer is option C. I will have very little difficulty swallowing. Vertical partial laryngectomy clients typically have minimal difficulty swallowing compared to those with horizontal procedures. Question 39. What is the priority nursing diagnosis for a client post-vertical partial laryngectomy? Option A. Activity intolerance. Option B. Ineffective airway clearance. Option C. High risk for infection. Option D. Altered oral mucous membrane. The correct answer is option B. Ineffective airway clearance. The client may have copious secretions and potential for edema, making airway clearance the priority. Question 40. What is appropriate teaching for a client anxious about an upcoming pneumonectomy? Option A. Provide opportunities to ask questions. Option B. Provide distractors like television. Option C. Tell her not to be nervous. Option D. Remind her this surgery is not extensive. The correct answer is option A. Provide opportunities to ask questions. Open communication helps clarify misunderstandings and allows the client to express feelings about the surgery. Question 41. A client with anxiety dusting her room is experiencing severe anxiety. What is the most therapeutic response? Option A. You will not be allowed to remain in your room. Option B. I would like you to walk with me. Option C. Tell me why the room must be clean. Option D. I inspected the room and it is clean. The correct answer is option B. I would like you to walk with me. Directing the anxious client to a positive activity helps channel energy and decreases the level of anxiety. Question 42. What should a client know about amitriptyline therapy? Option A. Prolonged use results in extrapyramidal symptoms. Option B. He will experience no anxiety. Option C. It should relieve symptoms of depression. Option D. A blood must be drawn weekly. The correct answer is option C. It should relieve symptoms of depression. Amitriptyline is a tricyclic antidepressant used to alleviate symptoms of depression. Question 43. What is the most likely goal of a client with severe anxiety and compulsive cleaning? Option A. Reduce anxiety. Option B. Avoid psychotherapy. Option C. Manipulate staff. Option D. Increase self-image. The correct answer is option A. Reduce anxiety. Compulsive rituals are used by clients to reduce intense internal feelings of anxiety. Question 44. A client with paralysis but no organic basis has a diagnosis of? Option A. Housework phobia. Option B. Malingering. Option C. Conversion reaction. Option D. Agoraphobia. The correct answer is option C. Conversion reaction. Conversion reaction is a physical manifestation such as paralysis resulting from an emotional conflict.